The nasal root is the top of the nose, forming an indentation at the suture where the nasal bones meet the frontal bone. The anterior nasal spine is the thin projection of bone at the midline on the lower nasal margin, holding the cartilaginous center of the nose. Adult humans have cilia in the anterior nasal passage at 4 weeks of gestational development. The neural crest cells, the precursors of the nose, begin their caudad migration, from the posterior, towards the midface. 2 symmetrical nasal placodes, the future olfactory epithelium, develop inferiorly, which the nasal pits then divide into the medial and the lateral nasal processes, the future upper lip and nose. The medial processes then form the septum, the philtrum, and the premaxilla of the nose. The lateral processes form the sides of the nose, and the mouth forms from the stomotium, the anterior ectodermal portion of the alimentary tract, which is inferior to the nasal complex. A nasobuccal membrane separates the mouth from the nose, respectively, the inferior oral cavity and the superior nasal cavity. As the olfactory pits deepen, said development forms the choanae, the 2 openings that connect the nasal cavity and the nasopharynx, upper part of the pharynx that is continuous with the nasal passages. Initially, primitive form choanae develop, which then further develop into the secondary, permanent choanae. At 10 weeks of gestation, the cells differentiate into muscle, cartilage, and bone. If this important, early facial embryogenesis fails, it might result in anomalies such as choanal atresia, absent or closed passage, medial nasal clefts, fissures, or lateral nasal clefts, nasal aplasia, faulty or incomplete development, and polyrrhenia, double nose. This normal, human embryologic development is exceptionally important because the newborn infant breathes through his or her nose during the first 6 weeks of life. Thus, when a child is afflicted with bilateral choanal atresia, the blockage of the posterior nasal passage, either by abnormal bony tissue or by abnormal soft tissue, emergency remedial action is required to ensure that the child can breathe. The nose plays the major part in the olfactory system. It contains an area of specialized cells, olfactory receptor neurons responsible for the sense of smell. Another function of the nose is to warm and moisten inhaled air. Nasal hair in the nostrils traps large particles preventing their entry into the lungs. Sneezing is an important reflex initiated by irritation of the nasal mucosa to expel unwanted particles through the mouth and nose. One of the most common medical conditions involving the nose are nosebleeds, in medicine, epistaxis. Most of them occur in Kieselbach's plexus. Nasal congestion is a common symptom of infections or other inflammations of the nasal lining, rhinitis, such as in allergic rhinitis or vasomotor rhinitis, resulting from nasal spray abuse. Most of these conditions also cause anosmia, which is the medical term for a loss of smell. This may also occur in other conditions, for example following trauma, in Kallmann syndrome or Parkinson's disease. The nose is a common site of foreign bodies. The nose is susceptible to frostbite. Nasal flaring is a sign of respiratory distress that involves widening of the nostrils on inspiration. Because of the special nature of the blood supply to the human nose and surrounding area, it is possible for retrograde infections from the nasal area to spread to the brain. For this reason, the area from the corners of the mouth to the bridge of the nose, including the nose and maxilla, is known to doctors as the danger triangle of the face. Specific systemic diseases, infections, or other conditions that may result in destruction of part of the nose, For example, the nasal bridge, or nasal septal perforation, are rhinophyma, skin cancer, for example, basal cell carcinoma, granulomatosis with polyangiitis, systemic lupus erythematosus, rheumatoid arthritis, tuberculosis, syphilis, leprosy, and exposure to cocaine, chromium or toxins. The nose may be stimulated to grow in acromegaly. The surgical procedure to correct breathing problems due to disorders in the nasal structures is called a rhinoplasty, and this is also the procedure used for a cosmetic surgery when it is commonly called a nose job. Some drugs can be administered nasally. Nasal administration can include nasal sprays and topical treatments.